The symptoms of cervical cancer are abnormal bleeding, typically during intercourse, abnormal pap smears.
Well, I'm a labor and delivery nurse. I would just say get a pap smear. Get your pap smears. Get a pap smear.
It is amazing how many advanced cervix cancers can be prevented by just going in and having your pap smears done. I can't stress this enough. New guidelines have just been published in terms of cervical cancer screening, which suggests that we now start our pap smear screening no earlier than age 21. Also, they initiated the new HPV co-testing with pap smears, which after the age of 30 typically allows us to be able to space out pap smears and cervical cancer screening to every 5 years as opposed to every 3 years with pap smears alone.
In Latin American culture, we usually don't go to the OBGYN until you're pregnant or until you really need to go, like there's something wrong with your body. So I went to get the exam, and it was really quick and it was not painful at all. And I'm really glad I did, because once you get your exams and you see that you're okay, it's a big relief that just lifts up your body, so it's really important.
It's estimated in the United States that half of women who get cervical cancer in the United States have never had a pap smear in their entire life, and another 20% haven't had a pap smear in the last 5 years or within screening guidelines.
Yo le dije para el año siguiente, y el año siguiente ya marcó una gran diferencia, un sufrir extra que me gané por decir, me lo hago el año siguiente.
Young women, particularly women in their teens, need to think strongly about the use of the HPV vaccine, which has the potential to eventually eliminate cervical cancer in the United States. In contrast, older women, for the most part, need to be simply more aware of their bodies. They need to be concerned with changes in the way they perceive their body, changes in things like appetite and bowel movements, or bleeding. Irregular bleeding from the vagina is probably the single most common symptom associated with the cancers that we deal with.
We know that most cervical cancers are associated with the human papillomavirus infection. So if we can prevent that infection by vaccinating patients early, then we are able to help prevent the development, hopefully, of a potential cancer in the future.
And in most women, that's just an infection that you live with. You have no symptoms. You don't even know it exists. But in some viruses, they have a predisposition to actually change those women's cells forever. And because it's silent, until cancer is developed, there are no symptoms. Even early cancer often doesn't have symptoms. The only way to know that the virus is there and doing this is with a pap smear. And that's why pap smears are so incredibly important.
I told my mom and my sister that they should go get a pap smear, and they're gonna go get it, so I'm really happy I told them about it.